You good?
You guys good?
Yep.
Hello.
Okay. Hello, we're about to get started here. Good afternoon. Welcome to the City of Toronto's COVID-19 daily briefing for Monday, March 23rd, 2020. Thank you for attending and welcome to those journalists who are calling in via WebEx. We'll start with questions on the floor, followed by WebEx, and so on and so forth. Greetings as well to the public watching this live stream on the city's YouTube channel. Fire Chief and General Manager of the City's Office of Emergency Management, Matthew Pegg, will speak first, followed by Medical Officer of Health, Dr. Eileen de Villa. Chief Pegg.
Thanks, Brad, and good afternoon. As you know, at 3 o'clock this afternoon, Mayor Tory declared an emergency in the City of Toronto. The formal declaration of a municipal emergency enables the City of Toronto to remain nimble and able to address emerging or evolving issues as they arise in an efficient manner and without unnecessary delay. The emergency declaration enables the Mayor to take further actions, including issuing orders as he considers necessary in order to implement the city's emergency plan or to protect the health, safety, and welfare of the individuals within the City of Toronto. This is the first time that the City of Toronto has declared an emergency. As you know, the Emergency Operations Centre is already fully activated. Today's declaration of an emergency does not impact nor change the operations within the EOC. While the declaration doesn't change the Level 3 status of the city's EOC, it does provide city staff with the necessary flexibility to access resources in a more timely way so it can continue to keep the city functioning and safe. We are effectively managing this emergency, responding to evolving and changing conditions as they develop, and are ensuring that each of the city divisions, agencies, and partners are in continuous connection and collaboration. As the head of Toronto's Office of Emergency Management, I am in direct and regular contact with the Mayor, City Manager, Emergency Operations Centre, and their respective teams, and of course, with the Medical Officer of Health. We continue to receive expert, timely advice, guidance, and direction from Dr. de Villa and her team in response to the public health COVID-19 pandemic emergency. The City of Toronto's response to the COVID-19 emergency remains coordinated, balanced, and effective. Our first priority, as always, is to protect the health and safety of both our residents and our staff, and we will continue to work non-stop to achieve that goal. I want to reassure everyone that our essential services continue without interruption. Our police, paramedics, and fire service professionals continue to deliver world-class emergency services. We continue to enjoy clean, safe, and reliable drinking water. Our garbage, organics, and recycling continue to be picked up and disposed of safely. Our shelters and respite sites remain open, and our city's most vulnerable continue to be protected. Our long-term care homes continue to operate. Our roads remain safe and open. Our electricity networks remain reliable and safe. Our public transit continues to operate safely and efficiently throughout the city. Our 311 system continues to ensure that our residents can get in contact with us when they need us. And of course, our amazing public health and healthcare professionals continue to lead from the front lines of this pandemic every day. The list of our team members who are supporting and enabling the uninterrupted delivery of essential services is long and includes critical roles like our corporate real estate management professionals who are keeping our facilities open, clean, and safe. Technology services who ensure that all our systems remain reliable. Procurement, materials management, and finance staff who ensure that we are able to order, receive, and pay for the personal protective equipment and other supplies that we need. Our mechanics who ensure that our city fleet is able to stay on the road. Our administrative professionals, lawyers, and experts who ensure that the city is able to efficiently and effectively respond to the ever-changing landscape that is emerging, and so many more. I would like to again thank each and every person who is working to ensure that essential and critical services continue in Toronto. I encourage everyone to make toronto.ca/COVID-19 their first point of access for credible information about the public health response and city service impacts. Each of us need to do our part to follow the recommendations and direction being provided by our public health professionals. The actions of every one of us make a direct difference in the outcome of this pandemic. Please do your part to help. In closing, I want to reassure everyone that we remain committed to leading our city through this pandemic. We are a strong and resilient city, and we will get through COVID-19 together. Thank you. It is now my pleasure to introduce Dr. Eileen de Villa.
Thank you, Chief Pegg, and good afternoon, everyone. As of 1 o'clock this afternoon, there are 239 confirmed cases of COVID-19 in Toronto. We expect to see more cases of COVID-19 in our city, both with and without travel links. As I've said before, community transmission is occurring. We all have a responsibility to protect ourselves, our friends, and our families from this virus spread. Toronto still has the opportunity. We still have the opportunity to slow this virus spread, but we need to work together. This is why today I am strongly supporting the province's order announced earlier today for the closure of all non-essential businesses. The province is doing this to reduce virus spread. And while the order does not require non-essential businesses to close until tomorrow night at 11:59, the sooner these non-essential businesses are able to close, the greater the impact on reducing virus spread. This is why I also continue to strongly urge everyone to keep a physical distance of 2 meters or 6 feet to prevent virus spread. For you, in your day-to-day life, this means staying home as much as possible, getting groceries only when they're needed, washing your hands often, and avoiding close contact with others. When you stay at home, when you keep your distance from as many people as possible, you help to protect yourself and your loved ones. But just as important, when you stay at home, you help protect those who are providing essential services, like those who are providing care to sick people in hospital, those who are protecting our city, our paramedics, our police, and our fire services teams, and those who are working hard to make sure that there's food on our store shelves and on our tables. When we stay at home, we help to keep these essential workers healthy. We help to keep them healthy so that they can do their jobs, so that our city can run safely. I understand that this physical distancing that I am urging you to do is not easy. In difficult times, we seek to comfort and be comforted by our loved ones. We seek support from each other, and we can still do this. Call your elderly neighbor to see how they're doing. Skype or FaceTime with your friends and family. Set up a virtual games night with your friends. Self-isolation may be taking its toll on many of us, maybe even all of us. We are all human. But at this time, physical closeness is exactly what we need to avoid. Please, do not put yourself, your relatives, or your friends at risk. The federal government, your federal government, is doing its part. Your provincial government is doing its part. Your local government is doing its part. Your mayor is doing his part. And now you need to do your part to suppress the spread of this virus. If you can, please stay home. Only leave your home if you have to. And if you have recently returned from travel outside of Canada, including travel to the United States, you need to stay home, even if you do not have signs or symptoms of illness. This is critical to protecting yourself, your family, your grandparents, your friends, and your city. I'm inspired by the many stories of compassion and acts of kindness that I hear of and see throughout our city. Each is an example of our city coming together and caring for one another at a very difficult time. We will get through this. So please, stay home, stay safe, and take care of each other. Thank you very much. We're now happy to take any questions you may have.
We'll start with Jamie from CP24.
Good afternoon. You just mentioned that you fully support the closure of non-essential businesses. Is a construction site, in your opinion, a non-essential business right now?
You know, I think it's an interesting question, and it depends on the nature of the situation. You know, I can't comment on every single construction project, and one might imagine that there are certain areas, repairs and things that need to be done in order to secure safety. So there may be some construction efforts underway that need to be taken care of in order to ensure safety of individuals in our city.
Another question has to do with long-term care homes and retirement homes. Many of these facilities are still hosting their breakfasts, lunches, and dinners in large dining rooms where they are being served by staff who I'm quite confident are taking the necessary precautions. But given the explicit instructions from health officials that we should not be congregating in large groups, you have arguably the most vulnerable part of the demographic who are now congregating together, and many of these elderly people are very concerned, and many of them are trying to fight to have those meals delivered to their rooms. What's your recommendation to long-term care homes, retirement homes, who are still hosting these dinners with large amounts of people?
So, you know, that's an excellent question, and I think it's very difficult. In fact, it may be impossible for us, you know, at this distance to comment on every single situation. What I think we can say is that where possible, wherever possible, we're asking people to practice social distancing, physically separating themselves from others wherever and whenever possible by at least 6 feet. There may be unique circumstances that prevent that from happening in every single situation, in every single long-term care home. But my plea to everyone is to practice social distancing, to maintain that 6-foot separation wherever possible in order to protect their own health and the health of those around them.
Okay, Jennifer Pagliaro from the Toronto Star. Jennifer?
Hi, Dr. de Villa.
Hi.
The mayor said earlier that you and I believe Chief Pegg advised him that he should declare a state of emergency. Can you just explain to us why that advice was given and what specifically the mayor and the operations center can now do?
Well, I may leave the second part of your question to my colleague, Chief Pegg. Why we were providing this advice, as we have for the last several weeks now, since January, we've been monitoring the situation, seeing what's happening in jurisdictions outside of Toronto and Canada, and observing virus spread. And as the virus was introduced into our community, we've been monitoring its activity very carefully here. We have made recommendations in respect of that which will protect the health of our population. And at this time, given where we are, we really felt that this was important and allowed for that flexibility and that agility that we need in order to address the health and safety of Torontonians. I don't know if Chief Pegg has anything further to add. I may have covered it for him.
Jennifer, do you want to hear from the chief, or do you want to follow?
Yeah, if you could just maybe speak to the specifically what can the operations center do with these powers, with the mayor's direction?
Sure, thanks. Hi, Jennifer, thanks for that question. So I'll start by saying this. You know, we all know that from the very early global onset of what was initially referred to as coronavirus, now COVID-19, and I mean going back into mid-January, the City of Toronto has been connected and has been ahead of this all the way through. The recommendation that was made today, of which I was a part of, really implements a legal construct that enhances our ability to be nimble and gives some additional delegation of authority that allows the mayor to make certain decisions in accordance with the Emergency Management and Civil Protection Act. In the event that we encounter situations where those decisions are necessary. So really, it is about the city continuing to be proactive. It is about us staying ahead and remaining in a position where we can effectively and efficiently manage this emergency as it evolves in the most expeditious means possible. And the declaration today sets that legal construct up that in order to make that possible.
And can I just follow up really quickly with Dr. de Villa? I wonder if there's any message to landlords or condo boards about what they should be doing to help residents. Should there be hand sanitizing stations? Should common areas in those buildings be closed?
So thanks for the question, Jennifer. We have a number of pieces of advice specifically for people who live in multi-unit dwellings, and probably too long to go through at this stage here. However, what I would say is that wherever possible, right, encouraging hand washing or good hygiene through the availability of sanitizer is always a good thing. Putting messaging out and signage out that reminds people of social distancing and its value. All of these things, I think, are very useful as we seek to address the impact of this virus on our community.
Mark Douglas from 680 News.
Dr. de Villa, I'll start with you while you're up at the podium already. Just to follow up on Jennifer's question about why now, was there a specific turning point? Was it a grand total that was exceeded that made you want to recommend a state of emergency? Was it an image you saw on the internet of people gathering? Was there anything specific about doing this now?
I don't know that it was one specific thing. It's the sum totality of our observations, and certainly if there was a particular issue or driving factor, it would be that we need to see better and more social distancing. There continue to be a number of people congregating in a way that frankly is not helpful in terms of what we're seeking to achieve in terms of trying to protect the health of our city. So, you know, I really felt that this was important at this time to make sure that we were doing the best we could to protect our health.
Follow-up for Chief Pegg. Chief, given the importance of declaring a state of emergency, can you give us some basic numbers now in terms of how many frontline paramedics, firefighters, and police officers, not necessarily civilian staff, but police officers, are in self-isolation now? Again, we don't want to give away people's personal medical information, but just numbers of each of those services, please.
I don't actually have the specific numbers with me, Mark. I can tell you that what is most important, the service levels being provided on the street by both, of course, by police, paramedics, and fire, continue to be at more than acceptable levels. Our residents continue to receive effective and efficient emergency response. And I mean, by way of a quick example, we know that there was just recently, a few hours ago, a third alarm fire on Wellington Street. A perfect example. Our city, our emergency services continue to respond. They continue to be effective and efficient, and that, of course, is one of our top priorities. And I'm fully confident that that will continue in an uninterrupted manner.
And I was down at that fire on Wellington, and yeah, there was an incredible response, and you would never think that there was any sort of shortfall whatsoever, so congratulations to your people for that great work. If you don't have specific numbers, let me just ask you in a more general sense. We already knew that from last week there was one paramedic who's in self-isolation. Are there, to the best of your knowledge, are there any police officers or any fire personnel who are in self-isolation?
Yeah, I would have to defer to Dr. de Villa.
Yes, please.
So in answer to the question, while I don't have the specific numbers either, I would imagine that there must be at least some. Some have traveled outside of Canada and are just returning, so would be appropriately in self-isolation for the 14-day period.
Thank you.
Okay, Haley Cooper from News Talk 1010.
Hi, my question is for Dr. de Villa.
She's at the podium, Haley, go ahead.
Excellent. So the Prime Minister said today that people have to stay home, that enough is enough. And it's just getting very confusing for people. Are they allowed to go out and, go for a walk, go to parks, maybe not play on playgrounds, but, what should people be adhering to?
So, I think the point is to try and maintain that distance, to really keep that social distance. So in my own remarks, I've said where you can, please stay home. This is the best way that we can reduce virus spread in our community. We recognize that people do need opportunities to get outside, to get some fresh air, to get some physical activity, and that's appropriate if social distancing can be maintained. We know that people will also need to go out to pick up essentials, groceries, things from the pharmacy. Again, we would ask people to minimize that, to go only when the essentials are needed, only when groceries are needed, and to try to keep that outing as brief as possible. So it is a stay-home message, recognizing that every now and again, people will need to go outside, but we're asking them to respect that 6-foot distance from other people.
And so for my follow-up, will public health be advising Mayor Tory to shut down city parks?
I think public health will be advising Mayor Tory on a number of things with respect to what is necessary in order to achieve our public health objective of controlling virus spread. So we're evaluating every situation, constantly evaluating what's happening in the city, constantly evaluating whether our current public health measures are having the desired impact, and adjusting course, adjusting our response, and giving advice to our decision makers on an as-needed basis.
Go ahead, Jamie.
Hi, Doctor. First question for you, and I have one for Chief Pegg as well. Just kind of going back to the construction sites, one of the things I also noticed, and from what these construction workers told me earlier, is they feel obviously concerned, but they're going to a construction site, many of them are walking to the nearby coffee store, then they're going to the nearby fast food chain, then they're going back to the construction site, then who knows where else are they going. Is there a specific message you maybe want to send to some of the foremen or construction managers about limiting the, walking around and maybe bringing lunch on the job to limit the spread? Because as you keep on mentioning over and over again, you want people to stay home, but there are construction projects, upgrades, and things that need fixings. What's the message some advice you could offer to some of the managers that are on those sites?
So the message is try to keep physical distance as much as possible. I recognize we all have to eat.
Mhm.
I was about to say we all need coffee. I think that's mostly true. I don't know that that's everyone's preferred stimulant. But many of us, let's try that, many of us need coffee to function. So, recognizing that these needs exist, the question is, how do you fulfill those needs, essential needs like food and perhaps coffee, while at the same time maintaining that 6-foot distance? So that's what I'm urging people to do. And to the extent that employers can create those circumstances for their essential workers, create circumstances that allow people to continue to meet their needs, to do their essential work, but to do so in a way that maximizes that physical and social distancing, then that's what we're asking people to do for the health and safety of our city.
And a follow-up question to Chief Pegg, please. Chief, I was at the 3-alarm on Wellington earlier today, once again witnessing firsthand the remarkable work of our Toronto firefighters and our fire service, but I also couldn't help but notice after many of them came back out of this abandoned building, back to the trucks, they're taking off their masks, they're all huddled together, they're huffing and puffing, some of them are changing tanks and whatnot and gearing up. What's the message you want to send to your firefighters who, quite frankly, there were a lot of them at this particular location doing their job as needed, but clearly not physically distancing themselves, but specifically when they came out, and I'm watching these guys huff and puff all over each other. What's the message you want to send to them?
Well, I can assure you, first and foremost, I will echo your comments. They do fabulous work. They did fabulous work today, as do our allied agencies with both police and paramedics that are always with us. Dr. de Villa has been very clear. Our overarching goal always is for all of us to exercise as much social distancing as is reasonable and is practically possible. There are functions, some of which you just described, like fighting fires and dealing with things like rehabilitation and bottle changes and some of the functions that happen on emergency scenes where it is difficult, if not impossible, to do that. And I won't speak for the good doctor, but all of the conversation we have had, and this is within the EOC, it is coming directly from the advice being provided by public health and is translated throughout, in the case of Toronto Fire Services, the chain of command there. We will and they are doing everything reasonably possible to protect all of our workers, recognizing the fact that they are in fact providing an essential service that is critical to the delivery of public safety. And as such, they will continue, as I know they will continue to do that with the primary focus being public safety as their first priority and not necessarily their own. So it's tough work under tough, demanding conditions any day. Under the circumstances we find ourselves in the city, it's all the more so. So my deepest thanks to not only fire service, but paramedics, police, all of our frontline healthcare workers and everyone else that are going above and beyond in order to keep our residents safe as we work through what is a really challenging situation.
Denise from Reuters, please go ahead.
Yes, Dr. de Villa. So you mentioned that there are a number of things that public health can advise Mayor Tory to do, and what we're seeing now, Mississauga is closing all their parks and whatnot. But can you give examples of what you're able to advise Mayor Tory on? Because I mean, Chief Pegg already mentioned a couple of essentials that will remain open. So what does this declaration actually mean for that? what powers can the mayor do?
Well, thank you for the question. I'm not sure that I'm the best person to speak to what powers are given to the mayor under the declaration of an emergency. However, what I can say is that since the discovery of this virus, and since we really started working on this early in the new year, again, the virus was discovered, or the illness was discovered in China in late December, and we've been active on this issue since January. And since that time, we have been monitoring very carefully what's been happening in respect of virus activity, initially overseas and more recently here at home, and providing advice and providing the response, leading the response as Toronto Public Health, in order to ensure that we are doing the best we can to protect the health and safety of the residents of this city. So what advice we might give the mayor in the future will depend on what we see as we go in the days ahead. If there are particular areas where we see that social distancing may not be being adhered to as well as it should be, that may give us the opportunity to consider what actions might be taken in order to effect better social distancing, for example. And that's just one example.
Do you have
Okay,
a follow-up,
thank you.
Denise?
And we saw Vancouver yesterday, I think, make it a bylaw violation for people to gather in public. Is this something Toronto would be looking into?
Well, what I've been doing at this stage of the game, in my capacity as medical officer of health, is putting the message out there and ensuring that people are aware of the importance and the seriousness of social distancing. So if you think about that, if people are following the message, staying home, only going out when they need to buy groceries and other essentials, and maintaining that 6-foot distance, then in fact, having very specific laws around congregation and how many people should be together, in theory, shouldn't be necessary. In public health practice, what we try to do is to use, education and communication in the first instance, and only go to more restrictive measures on an as-needed basis. So what we're doing now is really trying to make sure that people understand the importance of social distancing, recognizing physical distancing, keeping that 6-foot distance, recognizing that if people do that and they do it well, then in fact you won't have congregations to deal with.
Brian from the Toronto Sun.
Hey, good afternoon. I wanted to echo some of the previous sentiments to Chief Pegg regarding the great job of the Toronto Fire Department, but also the volunteers of the Box 12 Association as well. My question is for Dr. de Villa. I'm not too sure if I missed it earlier. You said there was 239 confirmed cases in the city. How many new cases do we have?
I'll have to check on those numbers specifically for you.
Okay, thank you. That's it.
Last question.
Hey, Jamie.
Hi, Dr. de Villa. This is actually coming from a viewer who's watching right now who's asking me to ask you this question. It's coming from a concerned mother and a healthcare worker, and I know you're a little reluctant to mention whether or not construction sites is an essential service, but one of the things that is staying open is the LCBO. And this individual wants to know, is the LCBO considered an essential service, and should we be shutting the LCBO down when we're continuing to see these long lineups and people just trying to stock up on their booze?
Well, I'm sorry to hear of long lineups in any facility, right? That clearly is not in keeping with the social distancing advice and very strong recommendations that we've been putting out there. With respect to the LCBO and its operations, whether we care to admit it or not, there are many people in our community who have significant dependence issues with respect to alcohol. And I think we have to be very conscious of that fact and be aware that if, that no longer, that substance, that provision is no longer available, that would lead to pretty significant health consequences. So I think there is a rationale, a reasonable rationale for that service to continue to be provided. But the important point here is social distancing, social distancing, social distancing. And being in lineups in close proximity, less than 6 feet from another person, is clearly not social distancing.
Thank you, everybody.
Thank you.